Kimberly Smith. I'm also with Assurant Health. I'm the project lead for medical travel within our organization. I think the most important thing to say is from the payer perspective, there are a lot more implications, considerations, and potential impediments that we have to be aware of. And I'm going to address a few of the implementation considerations and the impediments that our organization sees within this new opportunity. And I think the first one I want to talk about is the quality issue specifically. And I haven't really heard anybody today mention the fact that, yes, there are umbrella quality organizations out there, and hospitals are seeking accreditation and getting accreditation. At the end of the day, it's going to be the consumer that decides what quality is to them and what it means to them, and whether they're willing to take that leap. From this perspective, especially of medical travel, the consumer is making a decision to leave their home country for care, and they're going elsewhere for care. So this is a very different decision-making process. And from our perspective, we have to understand that decision-making process from the eyes of the consumer and make sure that the consumer is comfortable, and then it fits within our contracts and everything that we're able to do according to the state guidelines. So please don't forget that there are all sorts of quality organizations doing a great deal of very good work and bringing a great deal of transparency. But at the end of the day, if the consumer doesn't understand that, can't relate to that, can't embrace that, those quality metrics aren't really going to mean anything. So the communication to the consumer is very important, because this is going to be a consumer decision to do this. First of all, we are committed as a health insurer to following the new AMA guidelines. One of them is using JCI or other such global quality organizations. And the next important AMA guideline that we're really committed to is the coordination of care. And when we talk about coordination of care from an insurance perspective, we're talking about from the initial moment when one of our customers says, you know, I need to have my hip replaced and I can have it done here and it's going to cost X dollars, and I can have it done in a number of other places around the world for assorted prices. We need to start that continuum of care at that moment and then continue it all the way through the decision making, the actual commitment, the actual treatment, the local coordination of care when they return to the States, until that patient is released by a surgeon to return to their normal life. That could be the span of several months. So we need to look at it as a continuum of care, not little pieces or episodes of care. So from our perspective as an insurer, we either need to do that ourselves or we need to find partners to do that for us. So that's what we're really looking at when we look at med travel. We're looking at the whole piece and the quality of care that goes with that whole piece. It's really difficult when you consider that whole process, and that brings me to my second point, which is communication and the importance of communication. The communication process has to start from the beginning about explaining about the hospital, what they offer, what their history is, the hotel where the patient might stay, how they're getting from point A to point B. Will someone be with them at the hospital to help them if they don't speak the local language, to help, calm their fears? What hotel are they staying in? What does the hotel look like? What's their surgeon's background? How will they come back on the plane? I just had abdominal surgery. I can only lift 10 pounds. How do I get my 50-pound suitcase for 3 weeks out of the car, into the airport, onto the baggage carousel, things like that? So we're looking at every piece of the puzzle along the way, and we need to have every piece of the puzzle fit together and make sense and meet the needs of the consumer. So for a payer, it's very different, and we're going to be held accountable for every piece, and we need to have communication and we need to have coordination of everything. And I think the most important change that's going to need to happen is the role of the patient's primary care physician. And this physician is really going to be the point man, if you will, the person who makes the contact with the overseas